So, hi everyone, welcome to our first episode of Wax Connects with. Here at Wax Connect, we really believe the life science industry is built on people and the connections that they create, which is why we've launched this series to have relaxed conversations with the people behind our industry, exploring their career journeys, lessons learned, and the perspectives that they've gained along the way. So today I'm very delighted to be joined by Philip Haldar, who is an interim pharmaceutical marketing professional and who has built an impressive marketing and commercial career across the industry. So Philip, thank you so much for joining me today.
It's my pleasure, Heather.
Great. Well, look, let's start right at the beginning. Please, could you briefly introduce yourself and tell me a little bit more about what first attracted you to the industry?
Okay, so I'm Philip. I've worked in the industry over 30 years now, man and boy, as they would say. I graduated in 1990. This is when it was coming towards the end of Margaret Thatcher's reign, actually. And so the economy was not doing so well at that time. So I actually did a degree in fishery science and technology, marine biology. But unfortunately, I found at the end of that degree that there weren't any jobs at the time that were fisheries related that would allow me to buy a house. So I went back, like a lot of students, went back home. And now my father was an orthopedic surgeon, and he was the one who suggested that I look at pharmaceutical marketing sales. And so I met with a couple of reps and essentially went out with one of the reps from a company which was ICI in those days, I think it was, became AstraZeneca. And essentially, he basically gave me all the information I needed. That's how I learned about the role, and then I started applying for jobs. So my first role was as a GP, like many people who've followed my profession, as a GP sales rep. And I then went on to specialist care hospital sales. And finally, after about 6 years in sales, I made the step into pharmaceutical marketing. So, it wasn't planned, but I've enjoyed every step of that journey since I first joined the industry 36 years ago.
Oh, brilliant. And I'm excited to dive in a little bit deeper today. So you've had the opportunity to work in both permanent and interim roles during your career. So I'm curious, what different perspectives has that given you?
Yeah, so the longer term permanent roles really give you a chance to kind of develop strategy and give you time to kind of really get some in-depth thinking on the product, understanding the market. What I found with interim roles is that you don't always have that time because you're expected to come in and basically start doing the job pretty much from day one. So you essentially really do need to focus on kind of understanding the market, educating yourself around the market. I think the biggest skill that you can have with interim is actually listening, kind of listening to your hiring manager, listening to the team, kind of understanding what they're trying to achieve. So typically, I mean, at the moment, I'm working in an interim role for a company, and essentially I've got a 3-month role. And within that role, I'm launching a new product in a new therapy area for them. And so I had to come in with eyes wide open because it just happened to be a therapy area that I haven't worked on in the past. So I very much spent a lot of time understanding the market, before I met with the client, understanding, exactly. I'm doing a lot of using, like most people now, AI to kind of, understand customer perspectives on the products and the competitors. And so I think really there's a real onus on you to kind of educate yourself, understand the customer needs, understand the market before you even step day one into that company, so that you can essentially have a two-way dialogue. Because I think my role has always been asking the right questions. And I think that's what you need to be able to do. So you need to do your research before you step into a new role.
Absolutely. No, that's really interesting, and that how much you've highlighted how much that pre-preparation, that pre-research is super important. And I wanted to go in now into a little bit more about the kind of experiences and lessons that have shaped your career. So, what's one lesson that you think that you've learned that stayed with you?
Yeah, I think it goes. So the biggest lesson I've learned is that no matter how well you plan, no matter how deep your market research is, if you do lots of advisory boards, you will always get, a judgment or make decisions based on a relatively small pool of opinion leaders, and things won't go to plan. And I think you need to be able to change tact and be open to changing maybe a specific tactics that you're trying to do as you go along, because you learn most about the market when you finally launch, and when your reps are out there meeting with lots and lots and lots of customers, hopefully. And essentially it's that feedback that allows you then to really step back and say, is it, is it the right strategy?
Yeah.
Are we asking the right questions? Are we on the right path to success? And I think sometimes companies are we've got to stick to the strategy, and they're not open to changing it. And sometimes it may be that you require radical change in what you do. Not always. I mean, most of the time you get it about 90% right, hopefully. But I have been in occasions where we were, we didn't get it right at all, and we had to change the positioning and also the whole approach to selling the product.
No, I completely understand. And I guess expanding on that, and also some of the things that you've already talked around, listening and research, I wondered what skill or what mindset has been the most valuable for you throughout your career.
I think it's being open to ideas and suggestions from other people. I think I've always been open. I have ideas, I have biases, I have opinions, I have strong opinions on some things, like everyone else. But you're going to meet people who have worked in the market for longer than you have, who understand the customer more than you have, and you have to be open to their way of doing things. And I think that's the most important thing, is to be open to new ideas. I still love working in this industry. I still love getting new interim assignments, because I've never lost that, that, I don't know, I'm very inquisitive in terms of the new therapy area I'm working in is men's health, and I'm learning a tremendous amount by doing this job, and really loving every minute of it. So it's being open to, asking the right questions and listening.
Absolutely.
I think that's the biggest skill.
Yeah, being open means you get to keep it interesting, right? So it's
Exactly. Yeah.
Brilliant. And I'm sure kind of you've had this before, but marketing is one of the professions that I think people have some assumptions about. So I wondered if there was one misconception that you feel people have about a career in pharmaceutical marketing.
Yeah, so I'll tell you again, it's kind of my own perspective, is when I remember being a rep, seeing these new promotional materials and being very critical of them, and thinking to myself, I could do a far better job than that. And essentially, I actually thought marketing was just making pretty materials at the time, which in the 1990s, 2000s, it was very print heavy. It was, print detail aids. We didn't have, digital like we have now. But I think I had this, I didn't realize that how much market research you need to kind of analyze, how much customer needs analysis you need to do, how much understanding of the competitor you need to do. also, how much I needed to really understand the code and interpret the code in order to convince the medical team, the regulatory team to approve the materials that I would make. So I think when you look at marketing, you think of all the beautiful materials that are developed, the digital sales aids, the lovely web pages, but actually there's a hell of a lot of work. That's only kind of 5% of the job. The 95% is the thinking, the research that goes into making those materials. So I think that's what helped me, to having a science background. I was able to look at the market research that came out and develop materials that would work and meet the customer needs. But I think you underestimate the amount of thinking and assessment of the market that you have to do. The producing all the pretty materials is only a tiny part of that journey.
Absolutely. And you've talked a little bit there about how your understanding of the role has changed throughout your career, and the industry will have evolved enormously throughout your career as well. So how do you think the role of marketing has changed?
I think fundamentally, when I look at it, it's still, I still use what I learned because I did do a diploma in marketing as well. So I used to, use the SOSTT framework: situation, objective, strategy, tactics, and, time, and, implementation and control. It still roughly follows that, for every brand plan follows that process. So, but we have new tools now that enable us to do that market research much quicker. Analysis of the market research, much quicker. You still need to be able to conduct market research and ask the right questions. And that's where I actually think you need people that understand the market, that understand the questions to ask, and not rely on AI all the time, because you do need, if you don't ask the right questions, you won't get the right information back that can really shape a good campaign. So I think I've found that although we've got more tools now, you still need to be good at kind of interpreting what information is useful, what information isn't, checking all information that comes out from these tools, making sure that it's 100% accurate. I still read the clinical papers. I still read everything before I submit it into the medical approval process, to make sure that I'm happy with it, because I don't want to rely too heavily on other systems like AI to kind of, because at the end of the day, I'm accountable for anything that goes in there, and I want to make sure that it's 100% accurate, doesn't contain mistakes. So I think that's where, that's how I approach it. But, it has we've got so many more tools and so many more channels now than we had when I first started. But the fundamentals of how to use them, how to plan effectively, how to plan customer journeys is still the same.
Out of interest, do you think having all those tools makes it easier or harder from when you first started in the industry?
Oh, definitely easier. I said that I've just taken on a new role in men's health, and I relied heavily on, ChatGPT and Claude to kind of ask, okay, tell me about it. What should I be looking at? Give me a list of websites. Give me a list of, key people in this therapy area, so I can look them up and kind of look at what they've done on YouTube. What videos? It's a tremendous tool, because it just speeds that whole process up. So yeah, I'm a real fan of using it appropriately.
Absolutely, it's using it appropriately, ethically, and compliantly at the end of the day, isn't it? So yeah. Great. And I'm keen to understand, looking ahead to the future, what is it that excites you most about the future of the marketing function in pharma?
Well, I found that, we're trying to do more with less people now. Which sometimes works, sometimes doesn't work, but I do think we're coming full circle. So I try and get into the office in London at least once a week, and when I'm in there, just having those discussions over coffee, over tea, getting people to interact face to face, I do think it's really important. I don't think we can go fully remote. I think we learned during lockdown that it is possible, but we lost a few things. And I think we need to kind of bring back the culture in companies so that people are all working towards the same goal, and they understand, why we're selling the product in this certain way or promoting it in this certain way, and everyone works together, to support each other. I do think, that more and more companies are trying to get people back together again, and I think that's a good thing. I've already touched on the tools. They're much more easier. I think in many ways it's harder for me now. I've just been working with a media planner, and you've just got so much choice now in terms of where to place your ads, and you're heavily reliant on kind of assessing which channels are the right ones to do to hit the target customers that you're going for. Online channels, whereas in 20 years ago we didn't have so much choice, and so you'd have very few channels that you could kind of advertise in, but now there's so much, so it is much more complex, but because we have these tools, it does help us make the right choices, I think.
No, absolutely. No, thank you for that, Philip. And before we wrap up, I'm keen to understand, what's something you know today that you wish you'd known at the beginning of your career?
Yeah, so as a young man, I was very impatient. I was always trying to get things done really quickly and cut corners. And, I think as I've got older, it's kind of understanding people more, because at the end of the day, this job that I do is 50% human psychology, I think, because I'm trying to convince people that what the market is telling us is this, and essentially trying to get them on board. But, people have different ways of taking in information, different styles of how they like, some are very visual, some more like to take away things. And I've become more and more patient with people, and I've had to. I mean, I'm a father of 3 lovely daughters. They're all working now. And in fact, I'm going to be a grandfather very soon, not within the next few weeks, hopefully. And essentially, it's that patience. It's being more patient with people, but and allowing to kind of deliver information in the form that they respond to, and not try and just push things through for, because we've got a deadline. So yeah, I think that's really important, because at the end of the day, I rely on people calling me back to work for them, and I don't want to upset people, because my contract will come to an end, and I'd hope, even though I haven't got work straight away, that when the next contract comes up, I'll be front of mind, because I was easy to work with, I got things done, and I delivered on time. And I think that's really important.
Absolutely. I think that's a really good place to finish. And just want to say thank you so much for being one of our guests on Wax Connect with Philip. It's been a pleasure to speak with you, and thank you for sharing your experiences so openly with us. And a big thank you to everyone who's been watching today. I hope you've enjoyed this conversation, and we look forward to bringing you many more stories across the industry.
Thank you, Heather. It's been a privilege and good fun. Thank you.
Thank you.